from Malaysia. Now we are around 9 something here. Okay, all right. Okay, I'm going to present. Okay, all right. Thank you. My topic for tonight will be 8 plate in managing a pediatric lower limb deformity. Okay. When we talk about lower limb deformity, majority of us will think about whether the limb is equal with the in terms of the length, or whether patient will be varus deformity or valgus deformity. It depends what's the cause actually. Okay, but before we go directly to the 8 plate application, as usual, as a clinician, we have to make sure that we assess the patient.
Dear Dr. Kamariah, is the internet problem? Do you need help? You can click the green icon, share content. Dear partners, please wait a moment. We'll connect with our doctor. And later we will continue our speech. Thank you for your waiting. Dear Dr. Kamariah,
Hello?
hello, Dr. Kamariah.
Yeah.
Everything okay with you?
Not really. The connection is up and down. Okay. I will
can try again.
Sorry?
You can try again. Thank you.
Yeah. Can you see my slides now?
Sorry, I can't see the screen. Your presentation is not on the screen.
One moment.
Yes. You can click the icon, share content, the green icon. Yes. Yes, now we can see your presentation.
Okay. All right. Sorry for that.
Okay, it's okay. You can continue. Thank you.
Okay. For history, we have to also ask any complication from the primary problem. For example, whether the patient have initially injury, or whether have infection or other problems. And with that, after we get the history, we have to complete our examination. The patient's limb, whether it's there is a limb length discrepancy, and how much the discrepancy, whether it's just 2 centimeter or more, because this one will determine what will our next treatment. And we also have to evaluate whether patients have a neuromuscular problem or whether involve a metabolic bone disease. Okay, after the history, of course, we need to do a X-ray. It depends how old our child, our patient. For example, the elder patient, older age group, we have to do a scanogram by means that we have to take the X-ray at 3 different area, which is involve hip, knee, and ankle, where with the presence of the ruler, because we want to determine how bad is the discrepancy. And to treat the lower limb problem, actually we have lots of modalities. Is something that, for example, from our own observation, whether we can do hemiepiphysiodesis, whether we can do lengthening, for example, distraction osteogenesis using Ilizarov. Okay, for example, for tonight, we are going to discuss specifically regarding 8 plate. But before that, previously, to use what they call
Dear participants, sorry for the internet problem. And the speaker now is reconnecting to our webinar. Thank you for your waiting. Dear Dr. Kamariah, we can see your screen now. Dear Dr. Kamariah, could you please turn on your microphone? You can hear me, Dr. Kamariah?
Okay.
Yes, now we can hear you.
Yes. Can. You can, is it? Okay. Apart from staple, before that, some part of our country, we use a recon plate as if we when we don't have the 8 plate before. And after that, with the current development, use the 8 plate to control the growth of the affected limb. So, for example, the 8 plate, why it called 8 plate is because it's the size of the figure of the plate look like a number 8. And normally we use 2 screws to hold the bone. And the size is depend on how big is the bone and how big is the growth plate or epiphyseal plate. For example, if we need to control one-sided growth over the limbs, then we have to use a bit larger. So that's why earlier part, some of the surgeon will use a recon plate because it's a bit wider. And for example, earlier on, we use staples, whereby initially we identify the growth plate, and we knock in the 8 plate, the staples deep into the bone, and all that while we have to check with the image and intensifier. The problem with the staple, sometimes while patient during the follow-up, we notice the staples tend to dislodge because of the pressure during the prevention. The function to prevent the growth. Okay, this is a recon plate that I used to my patient before, because patient cannot afford 8 plate, so we use recon plate instead. Okay, for 8 plate, a little bit on 8 plate, actually is a 2-hole plate, and we use either a cannulated or solid screw to hold the plate. Okay, previously we don't have a targeting device, but now with the current development of 8 plate, there are a sleeve that can hold the 8, or we check on our eye. Okay, the function of 8 plate actually is actually to block the growth over the area that you put in the plate, and also at that particular area we can sort of control side to grow. For example, if you, for the bowing leg, you put the 8 plate outside on the outer part of the either distal tibia or the proximal proximal tibia or distal femur, and then you control, you lock with the screw, and then so the medial aspect of that particular bone can grow while the outer part stop growing temporarily. This is, for example, how we should target. We identify the growth plate. For me, I don't use any K-wire to identify, just by using RI, image intensifier. And then and then I'll put the 8 plate. Previously, when we don't have a locking targeting device, I just put and using my finger and check with the RI. If I'm satisfied with the position, I will put a sleeve and start drilling above and below the growth plate. And I will drill majority of the time, because I need to control, for example, the outer part, or I want the outer part to grow, so I will drill into the half of the condyle of the femur, and then screw. Previously, I used to use a cannulated screw, but now with the current one, I don't use a cannulated screw anymore. It's just a solid screw. Okay, the aim of 8-plate actually is gradually to correct, for example, the valgus deformity. From the valgus deformity, slowly it will correct until the leg straighten or less valgus. It depends on how much that we want to correct. This is an example of 8-plate. This is the plate, and we use 2 screws. Okay, this is an example of the X-ray belong to a child with bowing of both legs. For this patient, we monitor first because this is the first patient turned up to see us. It's a new patient. So we will observe his growth, whether the bowing is getting severe or not. And we will decide later whether we need to block. Okay, this is another example of the recon plate that we use for patient. Okay, for both leg, we put onto the lateral aspect of the femur and proximal aspect of the tibia. We are still waiting for the leg to overcome the bowing, the varus deformity. It is still new. And this one is valgus deformity occur for patient with multiple hereditary exostosis. We block the medial aspect of the femur, slowly grow on the lateral aspect of the femur, so the valgus will be corrected slowly. Okay, that's all. Thank you.